in San Diego, I think that we're jockeying between being number 4 and number 5 in the nation for worst case of houselessness. And we have a very high number of people who are unsheltered, which is a particularly difficult form. Leslie Lewis, and I am a faculty member in the Urban Studies and Planning Department and have been teaching there for about 12 years. I've also taught for anthropology and even taught a class for religious studies. My background is in anthropology and public health, and my interests are really around kind of, systems of inequity, and actually all of the systems and structures that shape our lives and shape our health and our opportunities, and then people's responses to those, ways that communities, work together to try to create conditions that that foster, health and equity and justice and peace and sustainability and all the good things that we want, or that people say we want, but that we have systems that are really operating against them. So I teach a lot of classes around that. Sure. It's a class that actually I have a co-instructor, Professor Rabinowitz-Basel, also worthy of being interviewed. We were approached by actually a philanthropist who was interested in having a new intervention to be sort of evaluated. It's called a safe parking program. It's relatively new in the panoply of responses that we've had to homelessness or houselessness over the past 4 decades. And it's basically for people who have lost their housing but still have their cars, and they're living out of their cars, and it's a safe place, usually with a guard, and you have a bathroom. I mean, we've done a survey of the country to see where else it's happening, and it can be as simple as that, just a few parking spots and a bathroom, all the way up to the program that we're evaluating is through the Jewish Family Services of San Diego, and they provide case management services, housing navigation, meals, I mean, all kinds of really good things, showers. So we were going to evaluate that, and we decided this would be really powerful if we created a course alongside it so that we could bring students along as co-researchers. So then, you can sort of be trying, achieving multiple things, because we need a lot of change in our kind of public attitudes also. So the hope was to really ground students in the historical, structural, cultural roots of mass homelessness, and what are some of the impacts, psychosocial health impacts of it. What's the ecosystem of services? How have we responded? And in both effective and ineffective ways. Sometimes our responses are actually even more harmful. So we wanted to sort of ground students in that, but then also train them in quantitative and qualitative research methods so that they can then participate. In the second quarter, we go out and they do oral history interviews, and they participate in these listening sessions with people who are using the site. So they are sort of co-researchers in that. And so they also get skills, and they come to understand maybe research in a different way, because I think typically there's this idea that research is like, oh, the people with the letters behind their names are going to come and study a group of people or whatever. And this is much more a model of study with. I mean, in the ideal, this would be, let's work with the community to come up with the very questions. We're not quite able to do that, although we come up with the questions with the students. But the community is really our teacher. And we need to think of ourselves as working with, they're really experts, right? They have wisdom that we don't have. And so how do we tap into that to help, address this problem with lots of different perspectives? Well, I think it's a surprise to people that housing insecurity is an issue for college students. The stats are not great, the research is not great, but the best estimates are, and I actually see this kind of reinforced because I do these pre-course surveys with a lot of my larger classes and ask students about this. But it's running, in my studies, 5 to 7% of students, raising that they're facing housing insecurity or instability. Typically across the UCs, they'll say 4 to 5%. 9 to 10% across the CSUs, and 20% in the community colleges. And so really high. And I think, the thing about, for students, I think housing insecurity is connected to food insecurity, is connected to, and economics insecurity generally, right? And that has implications for mental health, physical health, even academic success. So it's really a huge issue. And I think that there's a growing recognition of how much, we really need to be paying attention to the basic needs, basic physical, safety, psychological needs of our students if we want, them to be able to learn. In San Diego, I think that we're jockeying between being number 4 and number 5 in the nation for worst case of houselessness. And we have a very high number of people who are unsheltered, which is a particularly difficult form, where people are exposed to much more risk and victimization and exposure. I mean, so it's a significant problem, and it's linked to so many other problems, both in terms of what contributes to it and all the ways that it sort of is a cause of other problems. And, then you roll in, you think about, racism in our society and the ways it manifests in all the different areas of our lives. And so we see the same patterns among the unhoused. So, Black families are 7 times as likely to be in a shelter as a white family. I mean, it's stunning. And it's even beyond, we already have disparate rates of poverty, for example, and big wealth disparities. But even beyond the numbers we see in terms of poverty, we see then more so with housing. And that has its own history, deeply racist history, with redlining and where people can live and access to housing. And yeah, it's hard, because housing is, I think, or should be a right, and housing is healthcare. There's without stable housing, it's very, very hard to be okay in any sense, right? You're constantly vigilant, you don't have your basic needs met, and it's hard to then move on to those other kind of higher human needs when you're just stuck on those. Yes, there are points of hope. It is frustrating because this is literally a problem we're in the 4th decade, approaching 4 decades of this current sort of mass homelessness crisis. The only other time we have homelessness at a mass scale was after, in the Great Depression, and there was a really significant kind of a policy response to that. And that really did solve it. And for the most part, I mean, we'll always have people running into crisis, but what you want to have is what they call a functional zero of homelessness. So people might fall in, but that you quickly get them back out. And you do not have what we see, which is where, you have encampments and you have people. I mean, even, the numbers right now, the estimate is about 3.5 million Americans unhoused. That includes, people who are maybe sleeping on couches and floors and doubling up, and it's people in cars, and it's people in shelters, and people on the streets, unfortunately. But even that is almost surely an underestimate, because you can also look at stats at the education, sector. So you can see schools that kind of keep track of kids who are unhoused, and there's something like 2 to 3 million of those. So you think, okay, no, they're usually attached to parents, and so it's got to be bigger than that. But so it's a big problem. It's frustrating how we're not solving it. And there are a few places in the country where they've managed to solve veteran homelessness or chronic homelessness. And the way they do that is by getting really good data, coming to know people by name, and then working together, bringing services together to be able to address that. We really have kind of silos, and the whole ways we are set up, as people compete for contracts to provide services. So there's disincentive to share data. So we need to rethink all the ways that we are doing it. And that's just to kind of address how do we get people out? What we really need to be thinking about is those kind of baseline causes, because that's like the faucet of people falling into homelessness, right? We need to be operating at multiple places. So the baseline issues are, we have an affordable housing crisis. We do not have enough affordable housing for people, and we have an economic insecurity crisis. So people can be working a full-time job, 2 full-time jobs, and still not be able to afford housing. And until we solve those problems, we are just, because you have so many people just on the cusp, they're ready to fall over the cliff. And a lot of our services aren't even pulling them back from the cliff. That's one point of direct prevention, which we could do. I think the stat I heard was that it takes just like $1,000 to keep someone from falling into houselessness or homelessness, but 10,000 once they've fallen in. So that's certainly a point we should be intervening. Most of our services are actually at the bottom of the cliff. Like the ambulance shows up and okay, here's this unhoused person or this person who's been unhoused for 10 years, and they've got, they had to cope using substances, and it's so traumatizing that it affects their mental health. And so they've got all these issues. And so, we create even bigger problems than we had. So we need to care for people who are already in that place. We need to stop people from falling right over the cliff, but we really need to be doing the work back here where we get much more creative about how we provide, affordable housing. One, you perhaps have heard of Project Home Key, which is in response to COVID. It was like, oh my gosh, we really need to get people off the streets because this is dangerous. And so first it was Project Room Key. We'll get people temporarily into hotel rooms. And now there's this like, well, maybe there's all these hotels right now not being used. What if we purchased hotels and turned them into little SROs, single room occupancy places, so that people could have a safe place. They've got their own bathroom. Okay, they don't have a kitchenette, but actually most of those little kind of rooming houses don't usually, they don't usually have that anyway. So that's a light. And as I said, those other spots where they've solved it, it's where they've been able to work together. So I think there are a lot of good little light spots, but we also don't have very good data, and we're not sharing good data about it so that we can learn from it. We need innovative responses, and then we need to be gathering data and evaluating it so that we can then upscale those things that work and let people know the things that don't work, like criminalization. Like, that's awful. It's not working. I think that how we frame the problem and the stories we tell about the problem are critically important, because we're having to counter public attitudes that are rooted in really limited stories and misrepresentations. I mean, first of all, we blame unhoused people for homelessness, which is insane. Like, as if the people who are, vulnerable and burdened and do not have housing have somehow caused their own, harm, right? So we need to, in our kind of messaging when we're talking with people, to keep redirecting to the structural and historical and all of the kinds of root causes of this, because there are policy causes. There are reasons why we don't have enough affordable housing. There are reasons why we have this economic insecurity, that people can be doing exactly what they're supposed to be doing, working their full-time job and still not have enough money. I mean, that's just about basic living wage. We also have deep inequality, economic inequality and racial inequality, and that allow it to be the case that some subset of the population can own multiple houses or purchase them real cheap, and then basically we have housing as a commodity that is people can sort of invest and make money in, and instead of thinking of it as like a right and a home for people, like that is foremost what we should be doing. So framing the issue is really important, and then I think having actually human stories is critical, so that people need to recognize that, we have such a tendency, and we are, of course, helped in this, to otherize people, right? So, those other people over there, it is a way that kind of saves me from having to take any responsibility in a system that I might enjoy advantages in, privileges in. And it's a narrative that's comfortable for me because I don't have to, I can sort of say, well, that person is, they didn't work hard. They really just need to go get a job. And I've talked with lots of people who are unhoused, and they say they hear that all the time. If they're asking for money outside of a grocery store or something like that, get a job. It's kind of pathetic, but it's dangerous. This kind of knee-jerk reaction, this presumption that is somehow the cause. But the counter to that are really rich human narratives. So one of the things we do in this class is the students do oral histories. We did over 70 of them last year, and we'll be doing another 40 to 50 this year. And that is both an experience that educates the student, can be cathartic for the person telling it, hopefully not re-traumatizing. Hopefully it's in a way that they're able to share what they want to share, but just sort of share their humanity. And one of the things that the students have been struck by in the class is how much like them these people are. And that's, like we have had this panel last year, and a number of people, and it's one woman who is living in the local canyon. She starts talking about her life. She has a degree in biology. She was a teacher, and the students' mouths are dropping open. women, and every person they're talking with, oh, this person worked in this kind of arena, and this person did this, and you start to understand the proximate reasons why people fall into being unhoused. It's medical bankruptcy because they ran into a serious medical problem, and we have a medical system that is insanely expensive, and lots of people don't have insurance, and you do everything to save your health or your loved one's health, and then what are you supposed to do? Or a huge reason that women are unhoused is domestic violence. So we've got this violence issue. And so, it can be, sometimes it's mental health issues, sometimes it's substance use issues, but actually a lot of times those things arise after people are unhoused, because it's such a deeply traumatizing experience that, it really, if not causing, certainly exacerbates those kinds of problems. So I think sharing stories is really important, and reframing, and helping people with language. And if they're sort of using, I think often we have like the homeless. I think it's always whenever we use the language, it's a little dangerous. And as many advocates within the unhoused community will say, it's we're not homeless, we're houseless, right? Home is what we create with people we care about. Home is something that we create ourselves. Now, we do want shelter, we want housing, but we're not without that, because you also don't want to, you want to acknowledge all the burdens that people are facing, but you don't want to take away their agency and their fight back, their resistance, their resilience. You want to be able to kind of hold both and talk about both.
Thanks for watching. Hit the like button and comment with your own thoughts and experiences. If you'd like to see more content like this, please subscribe to our channel at Real Life Videos. Let's rehumanize.